I know it's blatantly obvious at this point to those of you who watch my videos. Shoot, if you're clicking on this video for the first time, this is the first time you are ever seeing my face, it's probably obvious. The first thing that pops into your mind, clearly this woman has elite genetics. And you would not be lying, but I just want to draw your attention to the fact that I am in the top 5%. As a young teenager, far advanced in my years, mind you, I was already formulating, developing, and had already acquired, was rewarded with, you guessed it, my very first cherry angioma. Those soft, red, small bumps that can appear anywhere on your skin, even inside your mouth. Most of you who are watching this, I know you're a little slow behind the curve, and maybe, just maybe, you didn't quite start making these until the age of 40, like most ordinary people. I get it. I understand. Not everyone can be at this level, but don't you worry. By the age of 75% of you will at least have one, if not many. Not only was I gifted enough to start forming these at a young age, but I continue to acquire them, collect them, if you will, what seems to be almost on a daily basis. And if you keep watching this channel long enough, come 2030, just you wait, I'm basically going to be one giant maraschino. So make sure you're subscribed and you have that little YouTube bell notification on so you don't miss out on that spectacle, because it will be a delight for the eyes. Now, it's come to my attention that some of you actually want to remove these. You want to know how to get rid of them, and you want to know, is there anything we can do to stop them from coming? While I can't relate, we will talk about it. What the heck are cherry angiomas anyway? They are these little tiny spontaneous growths. Basically, your blood vessels are lined with a cell type called endothelial cells, and sometimes they just decide, for whatever reason, they are going to disobey the rules, act abnormally, proliferate in a certain fashion, and form these little collections of attempts at making a blood vessel, only to have that lead to a little red bump. Now, if you have been needlessly worried about these, take a deep breath. Relax anyway. Breathe in, breathe out, relax, regardless of if you've got these and you're worried. If you're just sitting there, just take a moment to chill out. Everything is going to be just fine. Cherry angiomas, the joy of them is that they're almost like something that you collect. While they might not be something that you actually want or need long term, the good news is they are not harmful to you. They are benign, meaning they're not cancer. They don't turn into a cancer. They don't cause any adverse health effects. Because they are not harmful to your health, they're not cancerous, they're not dangerous, you don't have to do anything. Yay! But obviously, you all want to know if there is anything that can be done to get rid of them or to prevent them from appearing in the first place. First and foremost, you need to make sure that they are actually a cherry angioma and not something else, because there are other skin bumps that can look deceptively like a cherry angioma but are something entirely different. Something called a spider telangiectasia. There's also a sort of similar bump called an angiokeratoma. Then there is a skin growth of blood vessels that is such a nuisance. If you've ever had one, drop a comment down below, because they are annoying. It's called a pyogenic granuloma. Basically an outgrowth of blood vessels, oozes, bleeds, and will not go away. You have to have it removed. They are a pain. Here's why having a correct diagnosis matters the most, though. There are some skin cancers that can look like cherry angiomas. The most common skin cancer is basal cell carcinoma. Also, a really scary skin cancer is a melanoma. Melanomas can look like cherry angiomas in some cases. So you wouldn't want to miss out on those. In the case of a basal cell carcinoma, while they don't go on to cause necessarily significant harm to your health, they do put out these little roots. They grow slowly and expand over time. They need to be treated, and melanoma definitely can invade and become very deadly. So you wouldn't want to sleep on a melanoma diagnosis. So correct diagnosis, as with any skin, hair, nail, eye, mouth, body part, symptom finding, you need to have the correct diagnosis to know what to do moving forward. What can be done to get rid of them? There are a handful of common procedures that can be used to get rid of these. Although having a procedure to remove one does not prevent you from getting one somewhere else. What can be done? Well, one of the more simple things to do is to just take the electrosurgical tool and zap it with a little electrical current. Basically fries the little cells that make up this abnormal collection protection of blood vessels, makes the spot go away. There's also cryotherapy with liquid nitrogen. Both electrosurgery and cryotherapy as procedures to get rid of cherry angiomas, they're very safe, they're very effective, they're cost effective because they're very inexpensive tools to use. However, they can lead to hyperpigmentation, hypopigmentation, and possible scarring if not done properly. Sometimes your dermatologist might shave one out of your skin in an effort to clarify the diagnosis, and in doing so, they also treat the bump. Some dermatologists will pursue a vascular laser, namely pulse dye laser. A laser beam targets the hemoglobin in the blood. This treatment basically obliterates the lining of the cherry angioma. Unfortunately, as with most non-cancerous, non-dangerous, non-harmful little skin bumps, growths that do not actually need to come off for health purposes, well, guess what? Your insurance is not going to cover their removal. So most dermatologists charge a fee for this because it can be labor intensive to take care of many of them, and that becomes an expense for you. And like I said, none of these treatment options actually prevent you from making more of them later on. So it becomes this thing where maybe every couple of years you go visit your dermatologist, you pay a chunk of change, you spend time in their office having them removed, and then only to get more later on down the road. It can be very frustrating, and importantly, a lot of people don't have access to a dermatologist, or they don't have the time. Your dermatologist may be super booked up and not be able to take you in for having these removed because, you know, that's just how things go. Now, while these are not cancerous, not dangerous, the typical presentation with cherry angiomas is free to get one, and then over the next few years, you just start gradually accumulating more and more. I mean, for me personally, I've been collecting them since I was a teen. However, there is an exception to this rule that warrants medical attention ASAP. If you, say for example, wake up one morning and out of nowhere, you are covered in tons of these, that is a reason to immediately see your healthcare provider, because many internal cancers can release certain things that trigger an eruption of these. And so that can actually be a warning sign that you have an internal cancer. It should be investigated. So you don't want to ignore that. But if you're like me, you've been collecting them for some time, gradually they show up, that's the normal way in which they appear. I'm talking about these rare circumstances where a ton of them pop up overnight. That is a lot more worrisome and should be investigated and evaluated. We're going to talk about the stuff you can do at home to maybe get rid of them yourself and what I think about those approaches. But is there anything that you can do to stop getting these or to not get them? What could be done? The number one most important thing that you can do preventative wise is to not become an alcoholic. Alcoholics who go on to damage their liver to the point of cirrhosis often develop many cherry angiomas, as well as spider telangiectasias and a whole host of other vascular related skin findings, because when the liver is that damaged as a result of chronic alcohol abuse, it can no longer properly handle the normal estrogens in our body, and therefore we have excess estrogens as a result of that significant liver damage, and that can trigger more cherry angiomas as well as a whole host of health problems. Again, check out my video on warning signs of liver disease not to miss. We talk about a lot of the manifestations of liver disease from, say, alcoholic cirrhosis there. But long story short, aside from that, there's really not anything proactive that you can do to prevent you from getting these. They are likely related to sort of your genetics. I would say protect your skin from the sun, which you should be doing anyway, okay? To say that these are caused by the sun, I mean, people are getting them in places where the sun doesn't shine, including inside the mouth. That being said, having a lot of sun damage does compromise the integrity of the deeper layers of your skin, may facilitate the type of fragility that triggers endothelial cell proliferation and leads to cherry angiomas. So never a bad idea to be cautious with sun exposure. All right, so a lot of you guys are like, okay, whatever, I just want them off. And I don't want to deal with the whole dermatologist thing. So I went on Amazon and I found this, that, and the other, and it's got pretty good reviews. What do you think? All right, so first of all, you have a couple of things that people might try at home to get rid of these themselves. The first one is going to be a liquid freezing spray type thing that often is marketed for warts. You might think, oh, this is an at-home version of liquid nitrogen. It's not exactly. These things that are sold primarily for at-home treatment of warts, they're not actually liquid nitrogen. Typically dimethyl ether and propane. These don't actually get cold enough to generate the kind of freeze-thaw cycle necessary necessary to effectively, reliably destroy the bumps. So some people who choose to pursue these, say for a wart, might actually end up finding that, yeah, they were pretty helpful for clearing up their wart, but most people don't. And because they are suboptimal, at least in the case of warts, sometimes it ends up creating more warts for you as a result of just irritating the skin too much. Now, as far as a cherry angioma, not only do I have reservations with these for that because of the ineffective temperature, but you also run the risk of scarring, infection, bleeding. But the other more popular touted tool are these little at-home skin tag mole removal zappy things that you can buy on Amazon. They have a ton of them, and they have really, really good and compelling reviews, right? Like, people get on there, post their photos of, say, their skin tag, their cherry angioma, you name it, a before and after, and you're like, wow, sold, sounds amazing. Go on Reddit. You'll find people saying, oh yeah, I got one of these and it's been the best thing ever. I'm not going to the dermatologist and shelling out a couple $100 every year to have these zapped. I'm just doing it myself at home. These are a big question mark as far as how exactly they are working, because electrosurgery is kind of a broad category. You have electrodesiccation, you have electrocautery, and you have electrocoagulation, and they all sort of involve tweaking the settings in certain ways. These different parameters are manipulated in different ways and different approaches to either destroy cancerous or non-cancerous cells to get rid of a particular skin lesion, or to create what's called hemostasis, coagulation of blood, so things stop bleeding. The thing about these at-home tools is it's not really clear how they are supposed to effectively be used and what exactly the amount of electrical output is from these. Is it enough to truly destroy these cells, or is it just kind of surface glazing them and singeing the top of the skin? Not entirely clear. That's ignoring the safety issues with these. It's just, how do these work, and do they work similar to what is being used in office? I suspect no. I am troubled by the popularity of these, not because some greedy dermatologist who wants to get wealthy is zapping off cherry angiomas, okay? It doesn't work. Trust me, these are not something that dermatologists spend a lot of time pining over treating and getting wealthy off of. It just doesn't work that way. Like with the seborrheic keratoses that we talked about the other day, if there was a cream or a pill that people could get for, I don't know, 25 cents and use, apply, whatever, that would erase these and you'd never get one again, we would be the first people who would be applauding that, provided it was safe and effective as claimed. The issue here is that safety is paramount. So I don't feel comfortable recommending these due to concerns about, do they actually safely treat anything? Not to mention my reservations with people attempting to treat skin lesions at home without knowing 100% what it is they're treating. Are you zapping a cherry angioma, or are you zapping an amelanotic melanoma, burning the skin or potentially even causing bleeding? All right, y'all, that's what I wanted to talk about with regards to cherry angioma. I'm basically in an elite category of cherry angioma formers. I know many of you are probably jealous of me. I can sense it through the camera lens. Can feel you guys getting green with envy. It's not a good look, trust me. Having thousands of tiny little red bumps all over your body, it's a gift and it keeps giving, and I'm just better than everyone else, basically. Yeah, I am. All right, y'all. Speaking of benign growths that annoy us and that we want taken off, check out my video on how to shrink liver spots, aka seborrheic keratoses, because I go over some things in that video that will blow your mind. All right, y'all. I hope this video was helpful to you. If you liked it, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.